We will now take questions from the audience, but I'd like to take the opportunity first to ask Claire, where are you, Claire, in relation to the nursing experience for CRP testing in Swansea. How was it from a nursing perspective?
The nurses are really positive. I think nurses are integral with population health, and you know, the footprint of that we cover from a community nursing perspective is about making every contact count. And we are, you know, we have a large patient-facing workforce out there across primary care and the community. So these, you know, these elements of support, the training, education, knowing these escalation pathways are there for that quick response has been really positive. And I think the more work we can do in this area and training and education, I think is the way forward, especially as most of our nursing teams now are reporting a very different type of patient, far more complex, and obviously in delivering care closer to home, it's important we have these escalation pathways for rapid treatment, really, to prevent that hospital admission.
Yeah, brilliant. Thank you very much. Delighted to hear that. Can I now invite our audience?
I was struck as I was listening to various talks and thinking about the paediatric talk, and then Jean-Yves showed this lovely photograph, I think it possibly an ITU, but 4 beds. I wonder whether the time has come to start rethinking hospital design and increasing the footprint area per patient, so that we can have more space per patient, which may indeed double the size of a hospital for the same number of patients.
Thank you very much. I mean, to be very honest, there are recommendations, particularly for a neonatal unit design, and I would challenge any neonatal unit in the country, do they follow that cot spacing? Because it's providing that capacity within the unit. So if we want to, the recommendations are there, but we are unable to follow those recommendations because we have to nurse those patients. So our unit was commissioned for 24 cots, but we were delivering way beyond that, usually about 34 cots, you know. And where is the staffing for that? And you can see how transmission happens in that sort of environment.
Yeah, so I would pretty much agree, like the hospital design is tricky. You know, like our hospital was designed, but it probably needed another pod, so that the capacity and what you have is huge. If you think there's like 1,400 patients that go through our ED every day, it's you know, that is a challenge to clean and to get patients all the way through, and it's just like not big enough. So I think, you know, there's a lot of work anyway to do from like in the community, things like that, and so forth. So but that's like bigger problem. But
yeah, I mean it's always difficult when I think our colleagues have shown about the sink, you know, removing the sinks on making them fit to purpose. I think certainly a solution. That's an easy one. In terms of increasing the space, I don't know, more space to clean. There has been many studies, and one very big one from Australia, where you don't increase the space, but you increase the number of staff for cleaning and so on, and that really makes a huge difference in saving. And that's it, it's more patient care, and I think that's probably for me where we should go. And forget about, okay, the first year we can demonstrate a huge saving, but the following year you're not going to save any money, but you're going to control those MDRO. So I think it's a change of financial management, but more persons to help on cleaning, I guess.
yeah, I would agree with that. I think, you know, there's a common. I asked a question the other day, and I asked what people thought was the most important aspect of infection prevention and control. And I asked them what did they thought the environment played a role in infection prevention and control. I said, is that the most important? And it was a bit about a 50-50 split, what shocked me. So if you look at like what Jean-Yves talked about, Brett's Mitchell studies, the REACH study, you know, they're good RCTs. I know everyone says that it's like in Australia, but you know, they've done the REACH study where they've focused on a cleaning intervention, and that's reduced down the number of healthcare associated infections. Then the CLEAN study, what was looking at shared medical equipment. That's that's an RCT where they did 3 hours of cleaning per day, and they reduced down infections by 35.4%. So I think cleaning plays a massive role within that understanding. I do loads of talks on cleaning and understanding the science and the importance of that. I think hospital design and how you incorporate how we clean and have the space to do things is really, really important. But for me, the more I look at it, the more I think the environment is a massive role to play. I'm not saying hand hygiene is not important and things like that, but your environment, what you're picking up in that environment is massive. I only have to look down the sinks, metagenomics. Jean-Yves presented today. I know, Kavita earlier talked about the Oxford study as well. You find things in the environment. Just because you do a bit of environmental sampling and you don't find it, doesn't necessarily mean it's there. You can use different selective media, and then you can find out. If I want to look for a CPE in the environment, I can find it. So, it's having the tools for healthcare practitioners to tackle that. That's my thoughts.
And cleaning is a real technical skill, isn't it? It's you have to know what you're doing to clean, and of course nurses are not trained how to clean. So it's different to we're not talking about a quick wipe here. We're talking about proper cleaning in the correct way with the time to do it.
I work in a hospital not far from Great Yarmouth, and I used to work at City Hospital with Beryl. We're having a new hospital, and we've got some plans, but the proposal is no sinks in any side rooms. So just to clarify, I'm talking about side rooms that also contain patients that have got infections. Are we not worried that removing the sink from the immediate environment is going to adversely affect hand hygiene practices? Should I be worried?
I think for me, it's really important understanding water and being water safe. There's loads of evidence, especially in the intensive care units, by removing, hand wash basins, it makes a difference. I think you need to be sensible with what you're doing. So, I take my ITU, and it was a hospital. It's got 231 water outlets. That's a lot of water outlets that you don't need in an intensive care unit, and it makes it challenging for staff. It creates challenges from dead legs to all kinds of things. So I think it's really, focusing on water safe. There are, I wouldn't be so worried with yours. I think it's like a converse thought, isn't it? Because you need availability of it, but it's having it in the appropriate areas that you can use properly and safely. So I think for me, I think that the term, I've used it a lot, water safe. I think Kavita's talked about it as well, haven't you? You haven't completely got rid of the sinks, but it's how it's the thought process of having less, using them properly, and it's a whole holistic point of view, because you get staff who put things down the sink, you get patients who don't understand putting down the sink. I've had a patient who's emptied their stoma bag down the sink, and people go horrific with that, but that's what things happen in human factors. I've seen NG feed down the sinks, I've seen meropenem down the sinks. Kavita, you showed that study, didn't you, about that one where what people use sinks for, and it's fascinating what they do. So I think it's understanding that and taking out those human factors. But I still think you need education on water safety as well.
So I was just going to highlight that slide I had shown, that where there were sinks in the patient room, only about 20% of time they were used for hand washing. They were used for all other non-medical and medical use. And so when we were looking at, removing those sinks, we don't have any sink in the neonatal unit within the bay or in the baby single room. We walked around with our estates and facility teams and looked at where we should place the sink in the corridor where there is opportunity for hand washing. And important is, that education for the staff. When do you need to do hand washing, like an invasive procedure, putting central line in, and when, or soiled hands, and when you are going to use the alcohol gel. And again, the things to look at, what all products you can provide, which can provide an alternative to water. So lot of work which is needed, but it's not just a simple thing of just remove the sinks and, you know, get on.
Yeah, thank you. And I'm going to close this session in just a moment, but I have a very quick question for you. Does that include, have you retained sinks in the patient's bathroom if it's an ensuite room?
It's all planned, you will be.
You will be, okay. Yeah, brilliant.